Lifemd is a patient-centric, direct-to-patient healthcare company providing a high-quality, cost-effective, and convenient way for patients to access virtual medical care and pharmacy services. Through our vertically integrated care model, we combine proprietary technology, affiliated clinical services, pharmacy infrastructure, and artificial intelligence, AI-enabled operational systems to deliver longitudinal care at scale. As of June 30th, 2026, LifeMD served approximately 356,000 active patient subscribers across a range of healthcare needs, including primary care, men's and women's health, hormone health, weight management, insomnia, dermatology, and cardiology. We provide virtual clinical services as well as prescription and over-the-counter OTC treatments when medically appropriate. In June 2024, we began accepting commercial and government health insurance for our virtual primary care services, including obesity-related care for medically qualified patients. As of June 30th, 2026, our network covers approximately 175 million lives, including commercially insured lives, Medicare Advantage beneficiaries, and Medicare fee-for-service beneficiaries. To support our telehealth brands, in November 2024, we announced the opening of a state-of-the-art, wholly owned affiliated commercial pharmacy, marking an important milestone in creating a fully integrated, end-to-end telehealth platform. This 22,500 square foot facility, located in Lancaster, Pennsylvania, and designed to fill up to 5,000 daily prescriptions, allows us to offer patients a more cohesive care journey for relevant conditions, from initial consultation to prescription fulfillment within a single integrated ecosystem. In September 2025, we expanded our pharmacy to include advanced, non-sterile compounding capabilities for oral and topical medications so that we could deliver tailored therapies designed to meet evolving patient needs while improving efficiency and reducing reliance on third-party providers. Our weight management program, launched in April 2023 with a focus on GLP-1 medications, provides primary care, metabolic coaching, lab work, and prescription services as appropriate to patients seeking to access a medically supported weight loss solution. In September 2024, we expanded our weight management program to offer personalized, non-GLP-1 treatment plan consisting of 3 oral medications, metformin, bupropion, and topiramate, which is expected to grow the program's addressable market. Since inception, our weight management program has grown exponentially to approximately 108,000 patient subscribers as of June 30th, 2026. As part of our commitment to increasing access to branded prescription GLP-1 medications, we have developed an electronic benefits verification program that allows patients to check pharmacy benefits verification upon enrolling in a LifeMD virtual care program. Secondly, we have partnered with an AI-powered platform that optimizes prior authorization submissions and aims to improve approval rates for patients. Thirdly, we have established direct integrations with branded manufacturers who are also committed to lower-cost offerings. RexMD is our men's telehealth platform focused on conditions that are often underdiagnosed or undertreated due to stigma, inconvenience, or limited access to specialized providers. Since launch, RexMD has served approximately 732,000 customers and patients. The platform delivers virtual diagnosis, treatment, and prescription medications for men's health conditions, including erectile dysfunction, premature ejaculation, hair loss, insomnia, weight loss, and performance anxiety. TRT represents a defined specialty care program within RexMD and a growing focus area for the brand. Low testosterone is associated with a range of clinical symptoms, including fatigue, decreased libido, reduced muscle mass, and mood changes, and often requires longitudinal evaluation and management. Our TRT program is designed to provide comprehensive, ongoing care rather than episodic prescription access. Shapiro MD is a legacy brand offering access to virtual medical treatment, prescription medications, patented doctor-formulated OTC products, topical compounded medications, and Food and Drug Administration, FDA, approved medical devices treating male and female hair loss through our telehealth platform. Shapiro MD is a leading destination for hair loss treatment across the U.S. and has served over 261,000 customers and patients to date. Total revenue, net. Revenues for the 3 months ended June 30th, 2026 were approximately $47.3 million, a decrease of 4% compared to approximately $49.0 million for the 3 months ended June 30th, 2025. The decrease in revenues was attributable to a decrease in telehealth product revenue of approximately $2.0 million during the 3 months ended June 30th, 2026, compared to the 3 months ended June 30th, 2025, primarily due to a decrease in online sales demand. Cost of telehealth revenue. Cost of telehealth revenue, which primarily includes product costs, pharmacy fulfillment costs, physician consult fees, and shipping costs directly attributable to our prescription and OTC products, decreased by approximately 23% to approximately $5.3 million for the 3 months ended June 30th, 2026, compared to approximately $6.8 million for the 3 months ended June 30th, 2025. Gross profit. Gross profit decreased by 0.4% to approximately $42.0 million for the 3 months ended June 30th, 2026, compared to approximately $42.2 million for the 3 months ended June 30th, 2025. Gross profit as a percentage of revenues was approximately 89% for the 3 months ended June 30th, 2026, as compared to approximately 86% for the 3 months ended June 30th, 2025. Total revenue, net. Revenues for the 6 months ended June 30th, 2026 were approximately $97.4 million, a decrease of 2% compared to approximately $99.9 million for the 6 months ended June 30th, 2025. The decrease in revenues was attributable to a decrease in telehealth product revenue of approximately $3.0 million, primarily due to a decrease in online sales demand, partially offset by an increase in telehealth subscription revenue, primarily for Lifemd virtual primary care, which experienced an increase of approximately $534,000 during the 6 months ended June 30th, 2026, compared to the 6 months ended June 30th, 2025, primarily due to an increase in online sales demand. Cost of telehealth revenue. Cost of telehealth revenue, which primarily include product costs, pharmacy fulfillment costs, physician consult fees, and shipping costs directly attributable to our prescription and OTC products, decreased by approximately 25% to approximately $11.2 million for the 6 months ended June 30th, 2026, compared to approximately $15.0 million for the 6 months ended June 30th, 2025. Gross profit. Gross profit increased by 2% to approximately $86.2 million for the 6 months ended June 30th, 2026, compared to approximately $84.9 million for the 6 months ended June 30th, 2025. Gross profit as a percentage of revenues was approximately 89% for the 6 months ended June 30th, 2026, as compared to approximately 85% for the 6 months ended June 30th, 2025. On January 2nd, 2026, the company entered into a credit agreement, the credit agreement with Citizens Bank, N.A., Citizens, which provides for a senior secured revolving credit facility in an aggregate outstanding amount not exceeding $30 million, the credit facility, for general corporate purposes. The credit facility may be increased in the aggregate principal amount of up to $20 million on the terms and subject to the conditions described in the credit agreement. As of June 30th, 2026, and to date, the company had not drawn any amounts under the credit facility. The company expects that its existing cash as of June 30th, 2026 of $25.1 million and net proceeds from the sale of common stock under the ATM sales agreement will be sufficient to fund our planned operating expenses and capital expenditure requirements for at least the next 12 months from the issuance date of these unaudited consolidated financial statements.